Estimados colegas y amigos, soy el doctor Antonio Posada Domínguez, oncólogo ginecólogo de México. Quiero hacer una pequeña introducción a una entrevista que tuvimos con la doctora Rebecca Glaser, quien es una autoridad en el manejo de pacientes con cáncer de mama y tratamiento hormonal con testosterona e inhibidores de aromatasa. Presentaré algunos detalles breves de su amplia trayectoria en este campo. La doctora Rebecca Glaser es un cirujano de cáncer de mama ampliamente reconocido a nivel mundial por su trayectoria. Ha tratado más de 1,500 pacientes en forma personal, actualmente retirada de la cirugía y dedicada principalmente a la investigación sobre la testosterona en pacientes con cáncer, en pacientes sin cáncer también. Ha estudiado y publicado artículos en relación a la farmacocinética y farmacodinamia de la testosterona y su asociación con inhibidores de aromatasa como el anastrozol, letrozol. Ha publicado numerosos artículos, los cuales tienen más de 2,500 citas a nivel internacional en diferentes publicaciones, y actualmente se dedica a la investigación sobre este tema de testosterona y pacientes con cáncer de mama. Es para mí un gusto y un honor presentarles a la doctora y una pequeña entrevista que hicimos en la ciudad de Guatemala durante el Congreso Internacional Iberoamericano de Ginecología Regenerativa, Estética y Funcional.
Hello everyone, I am Dr. Antonio Posada from Mexico, and here we have the honor to be interviewing Dr. Rebecca Glaser, which is my teacher, and I've been following her instructions and her readings and articles since so many years ago. And I'm very honored. We are here in the middle of the meeting in Guatemala in the gynecological rejuvenation and regenerative medicine. And we're going to be talking with her about hormones in women and hormones and cancer, mainly testosterone. This interview is going to be translated in Spanish later, but it's very pleasing for me to have here with us. First question that I have for you, and which is very controversial for most doctors and women, is what do you think about testosterone? First, you tell me the good things about testosterone, and then you tell me the harm things of the risk without testosterone. What happens to women when they lose testosterone? Okay, first, benefits of testosterone.
That's a great question.
Okay, thank you.
First of all, most physicians don't know that testosterone is the female most abundant hormone. We have more testosterone, 10 to 15 times more testosterone than estrogen. It is the queen of health.
Well, yes.
The queen of health.
The queen of health.
Yeah.
What would you think that be the main benefits in females of testosterone? Let's say 3, because I know there's a lot of benefits of testosterone, but 3 or 4 of them.
Okay, I think testosterone affects every cell in the body, but probably the main 3 or 4, energy, sense of well-being, brain function, emotional stability.
Perfect. What about your cardiac health, cardiovascular health?
You need testosterone for cardiovascular health. For bone health, you don't have testosterone, you lose bone.
Question, Rebecca, if you be so kind to tell us, what would be the risk of a woman when they lose testosterone, and what about the age when women start losing testosterone? That's a good thing, and maybe we could go to the next question, when to start replacing testosterone.
Okay, that's cheating. 3 preguntas in one.
3 questions in one. 3 preguntas en una.
No, testosterone, when you start to lose testosterone, you lose muscle mass, bone density, but nobody thinks about emotional stability, memory. Do you know what I mean? You lose memory. You lose that sense of well-being, of being happy and not depressed.
Yes.
So those are things people don't think about with testosterone. Everybody knows sex drive and libido. Everybody knows that's related to that.
What do you think about depression and testosterone?
Oh, it totally affects depression. Low testosterone, you get depression, you don't feel good, you're not happy, you can't lose weight.
Yes.
Yeah, and that makes you more depressed.
Okay, now we were talking about the risk of replacing testosterone in females. In women, what is the risk in breast cancer?
In breast cancer?
Breast cancer.
That's a really interesting question. There's a lot of misconceptions about testosterone and breast cancer. In fact, it's actually listed as a contraindication in male testosterone.
Yes, of course.
But what we see is that testosterone protects the breast.
Protects the breast.
Everything from the cellular level to the incidence of breast cancer.
Yes.
In fact, we followed patients now for 15 years that are on testosterone therapy, and the risk of breast cancer is about half of no hormone therapy.
You're about to publish that information, right?
Well, we submitted it.
Yes, of course. Because testosterone works as an antagonist to estrogen. So when you have more estrogen and less testosterone, there's the risk of breast cancer.
Right.
When you give testosterone, it balances the proliferative effect of the estradiol.
That's exactly correct.
Good.
It's that ratio of testosterone to estradiol. Estrogen stimulates breast tissue, and just like you said, testosterone prevents that stimulation.
One another question, very interesting and very controversial also, is the topic about women that have had breast cancer or breast cancer survivors. What about giving them testosterone or testosterone with an aromatase blocker?
Right.
What?
That is probably the main focus of my research.
Yes.
And I treat women with a history of breast cancer, or sometimes even active breast cancer.
Yes, we have
women
patients
with metastatic disease that are suffering, and we treat them with testosterone, which markedly improves quality of life. Hot flashes, energy, muscle mass, brain function, joint pain, all of those symptoms that breast cancer survivors get. And the testosterone really helps those symptoms. And what we're seeing in our data is that it actually decreases the recurrence risk.
Yes, that's very interesting because besides giving these women a better quality of life, you don't get the prognostic worsen. So it gets even lower rates of recurrence rates.
Right. But the one thing you need to remember is when you give testosterone to a breast cancer patient with hormone receptor positive or estrogen receptor positive breast cancer, you have to give them the aromatase inhibitor.
Yes.
You
like
have to block the conversion to estrogen.
Yes, that's perfect. Okay. Now, another question that is often asked by the patients, what's the best way to give testosterone to a woman? Is it transdermal? Is it orally? Or is it a pellet? What do you think about what is the best way that a woman should have testosterone?
Well, I'm glad you asked that.
Okay, good.
I've been doing this a long, long time. And the only way that is really the most effective way is through that subcutaneous implant. It's a little tiny piece of testosterone, often combined with the estrogen blocker right in it, okay? You simply insert that in the subcutaneous fat under the skin, and 24 hours a day, 7 days a week, it releases these minute quantities of hormone, much like the body did when you were 20 years old.
Yes, like continuous way.
Continuous.
Yes, doesn't have peaks and downs and peaks, and it's continuous.
Right.
Okay, we're almost getting to the end of this wonderful and very interesting interview with Dr. Rebecca Glaser. One other question is, what about postpartum depression and giving testosterone or replacing testosterone to a patient, or a patient that is breastfeeding? What about testosterone? What do you think? Would it help? Do you think it's
I think it would really help postpartum depression. Like I mentioned earlier, it is huge for depression.
Yes.
And think about after having a baby, your hormones are really in flux. And we found that giving testosterone in a patient with postpartum depression is very beneficial for mood. For mood, it stabilizes the mood, makes them happier, and it's a lot better, I think, than chemical drugs.
Yes, of course.
And we did look. We looked at the levels in mother's serum, mother's milk, and baby's serum, and there was no adverse effect whatsoever.
Okay,
so I think it's probably one of the safest, quickest ways to treat postpartum depression.
Perfect. Thank you very much. Okay, well, that was a wonderful interview that we have with Dr. Rebecca Glaser. I'm very honored.
I'm very honored. I'm very honored.
Thank you very much. I've been doing a lot of work with our patients in Mexico with breast cancer patients, doing the same protocols as you do in the United States. And we would like to thank you for this interview. Very pleased.
De nada.
Nice to talk to you again. Thank you very much.
De
It
nada.
was another.
Gracias.
Gracias. Thank you very much.